what now is the course of treatment in the UK? I mean, what would be the patient journey, to use that awful expression? They go to their GP, they say, I'm feeling dizzy. What happens to them then?
Well, probably the GP will sort of, most importantly, make sure it's nothing serious. That's the fundamental rule, isn't it? Rule out the red flags. But assuming it's nothing serious, then they may well give them some medication, typically sort of Prochlorperazine, Cinnarizines, or common names, Stemetil. And this is really just to stop them being sick, because there isn't a medical, a drug, pharmaceutical treatment for dizziness. Although most people do get drugs, they don't really work long term. They're just going to stop you being horribly ill to start off with. So you'll probably be given a medication and hopefully told that it will get better by itself. And it should. The vast majority of people, that's not true. 50% of people will get better by themselves.
Over what course of time?
Over a relatively quick period of a few weeks, a couple of weeks or so, something like that. And that's what we'd expect. But half the population probably don't. And the reason they don't is generally because they start to do the wrong things. Recovery depends upon the brain getting a lot of feedback. And the feedback, means really signals from the eyes, the ears, and the vestibule, and the neck, and proprioception from the rest of the body, but particularly the eyes and the neck. And in practice, that means movement, movement of these bits of the body. And if you move, you'll generate enough feedback for the brain. The brain will work out it's getting it wrong, and it can sort the problem. But that means doing things which make you feel dizzy, and that's scary and it's unpleasant, and so people avoid it. And so then they fuse up around the sort of the neck and the shoulders. They become very stiff. They don't move the head, or if they do move the head, it's eyes and head and trunk. Everything's moved together as one, a bit like a lighthouse or something. And so the brain doesn't get the feedback it needs. And then that's when you end up getting these more chronic dizzinesses.
Okay. It must be quite challenging with patients, encouraging them to do something which might make them feel sick or encourage vertigo, for example.
Indeed, yeah, and it is, and that's why they have to understand the situation. But yes, you are ultimately asking somebody to do something which is not very nice. But I always like to equate it with physical training. It's just the same as getting out of breath. If you want to get fitter, you have to get out of breath. If you avoid getting out of breath, your heart and lungs, musculo-skeletal system will never ever sort of improve. Yeah.